Good morning and welcome to Sunday Today on this March 29th. I'm Willie Geist. As you can see, Studio 1A, the bustling home of the Today Show for more than a quarter of a century, nearly empty this morning as our amazing production team puts on a show largely from home with a small handful of them downstairs in the control room. In here, just me and a single cameraman, Chris. Let's get right to the latest on the coronavirus pandemic that has us working like this. Overnight, a travel advisory was issued by the CDC for New York, New Jersey, and Connecticut. The advisory came just hours after President Trump suggested he was looking at a quarantine for those areas, an idea he later walked back. In the last 24 hours, the number of coronavirus cases here in the U.S. jumped by more than 20,000 to well over 121,000 people. As of this morning, the death toll is now just over 2,000. And some hopeful news this morning as Houston Methodist becomes the first hospital to use plasma therapy to help treat coronavirus patients. The hospital will transfuse the plasma from a recovered patient into a critically ill one, hoping to build up immunity in the sick patient. We will have much more on all of that just ahead. And we'll talk to a doctor who's now working inside an ICU about the strain on healthcare professionals on the front lines. And later in our Sunday Spotlight, the staggering economic impact of the virus that has brought American business to a standstill and the well-known retailers that may not survive. Then in our Sunday closer, Harry Smith introduces us to the music students who became viral stars by delivering some of what the world needs now. And later, we will beam some light into another difficult week when we revisit one of our favorite Sunday sit-downs with actress Kristen Bell on the record-breaking Frozen 2, the end of NBC's The Good Place, and the moment she met her husband, Dax Shepard. Do you remember initial impressions
100%.
of Dax? You do?
Mm-hmm. I was like, this guy can talk. And then I didn't know who he was. I'm like, maybe is that one of the guys from Jackass or something?
A Sunday sit-down with Kristen Bell, plus another life well lived a bit later in the show. But let's begin this morning with the travel advisory now in effect for 3 states that make up about 10% of the country's population. The advisory came just hours after President Trump suggested a possible quarantine of those states. NBC's Kathy Park is outside of New York City's Javits Convention Center, which right now is undergoing a massive transformation. Kathy, good morning.
Willie, good morning to you. Here in New York State, the death toll is just alarming. More than 700, and infections are supposed to peak in between 14 to 21 days. And because of this ongoing crisis, the state has taken some serious action, like transforming this massive convention center behind me into a temporary hospital, which opens up tomorrow. This morning, a CDC travel advisory for residents in New York, New Jersey, and Connecticut now in effect, asking them to refrain from non-essential travel for 14 days.
We'll do a quarantine.
President Trump initially raised the idea of an enforceable coronavirus quarantine in the tri-state, but backed down, tweeting late Saturday, a quarantine will not be necessary. The initial proposal drew criticism and confusion.
This would be a declaration of war on states.
Words matter. And when you lack clarity, that can create confusion, and confusion can lead to panic.
Meanwhile, as the virus continues to spread, a naval hospital ship is on its way to New York, the U.S. epicenter of the outbreak, where cases have gone beyond 50,000. Late Saturday, the New York Knicks announced that its team owner, James Dolan, tested positive for COVID-19. All across the country, states are bracing for the worst, building pop-up hospitals to deal with the influx of patients. On the front lines of the crisis, growing outrage over the shortage of medical supplies, leading to protests.
We're incredibly frustrated. We know that the federal government can give us these resources.
U.S. mayors are also sounding the alarm, citing a survey that around 90% of their cities don't have enough masks, test kits, and other personal protective equipment. The Surgeon General warning Detroit, New Orleans, and Chicago could become the next hotspots if they're not able to bring down the numbers. To keep the virus at bay, Rhode Island is cracking down on incoming New Yorkers, telling them to self-quarantine for 14 days. Around the world, the death toll is climbing, more than 10,000 in Italy and passing 6,000 in Spain. but a promising sign in China's Hubei province, where COVID-19 was first identified. 5 consecutive days with no new infections as life is slowly getting back on track. And back here in the States, some breaking news overnight in Maryland. 66 residents at a nursing home in Carroll County tested positive for COVID-19. 11 of them are now hospitalized. Willie?
So much concern about nursing homes across the country. Kathy Park in New York, thank you very much. So why did President Trump at first float the idea of a quarantine for the hard-hit states of New York, New Jersey, and Connecticut? An idea he later called not necessary after he received criticism, as you heard a minute ago, from governors of those states. NBC's Kelly O'Donnell is at the White House with more. Kelly, good morning.
Good morning, Willie. The president's quarantine idea formed and fell apart in just about 8 hours. President Trump suggested the measure after I asked him a question on a different topic. He said he had just spoken to Governor DeSantis of Florida, and as we know, Florida has been concerned about travelers from the New York, New Jersey area bringing the illness south. Of course, Governor DeSantis has also been criticized for not closing public beaches earlier. While the federal government, through the CDC, does have powers to quarantine in an emergency, the president and his advisors did not answer my questions about what legal basis the president would use for what he called an enforceable quarantine. So, of course, the uproar was swift. It was loud. Governors from those 3 states raised many concerns about the impact and the potential chaos. And so a 2-week travel advisory was issued instead. And Connecticut's governor summed it up this way. He said the White House was thinking out loud. Willie?
All right, Kelly O'Donnell at the White House for us. Kelly, thank you as always. Let's bring in NBC News contributor Dr. Vin Gupta. He is an intensive care doctor working right now with coronavirus patients and a global health policy expert who sounded the alarm in 2018 that a pandemic was coming to the United States. Dr. Gupta, thank you very much for being with us this morning. We appreciate your time during a very busy time for you. Let's start with, at the end of this week, another long, difficult week for the country, of where we are in terms of numbers, in terms of the trajectory of all this, in terms of whether or not social distancing is in fact having an impact in the positive. Where do you see where we are right now, Dr. Gupta?
Thanks, Willie. Thanks for giving this such an important platform. Every expert in this field, whether a study out of Harvard 2 weeks ago from Ashish Jha and his colleagues, just 2 days ago, University of Washington, the Institute for Health Metrics, major universities have published forecasts saying this is going to get a lot worse. Cases are going to climb. ICU needs are going to become more and more urgent. We haven't seen the worst of it. It's getting worse, not better. Cases are continuing to climb, as you're noting. So, Willie, we're not even remotely close to being out of the woods yet. This is, and what I'm seeing here in Seattle is a state that has incredible hospital leaders and a governor that has been on the forefront of a response. But we have no idea if social distancing, I think, is having the effect that we hope it has. One, because it's been implemented with such diversity across the country. So I think we're making progress qualitatively in places like Washington, from what I understand from colleagues in other states as well. But who knows? Because we don't have good testing. Testing is still lagging. And I think we've oversold where testing is at the moment. It's not where people think it is. There's still significant challenges.
So, Dr. Gupta, as I said, you are on the front lines treating coronavirus patients. Some are gravely ill, as you have pointed out to us. What is the need inside your hospital and across hospitals in this country for that personal protective equipment so that doctors like yourself don't get sick and they're taken off the field?
Well, I want to give credit to my hospital and the hospitals across Seattle that I'm working with colleagues across health systems here in Washington State. We are protected, which is to say that we are protected at the moment. Forecasting out what are the needs going to be here locally, we're going to need a lot more of it, which is why the Defense Production Act and implementing it with intention is really key. And so the forecasting model suggests we need more, not less. Right now, we're okay. Where I'm concerned is my colleagues in New York City and wearing garbage bags instead of gowns, not having enough N95s when they need it, when they're chronically exposed to patients that are aerosolizing COVID-19. So this is a different story depending on what location we're talking about. Right now, it's a patchwork approach Different zip codes across the United States have different needs. We obviously need more PPE. It's completely unacceptable that physicians, ICU docs, ED docs, nurses don't have the materials that they need. And we know that we're not going to have the materials that we need come mid-April when these cases spike.
All right, Dr. Vin Gupta, thank you for your insights and thank you for what you're doing as you go in your scrubs right now and work with coronavirus patients. We're so grateful as a country for you and all the healthcare professionals out there. Thanks for your time this morning.
Thank you.
Chuck Todd is NBC's political director and moderator of Meet the Press. Chuck, good morning. Good to see you as always. Let's take a look back at the president's handling of this. Just yesterday, we can focus on that, where he came out in front of the cameras outside the White House and suggested a quarantine for 3 states that make up about 10% of the United States population, sent people scrambling around here in New York, in the New York area. It's been so hard hit, and then walked it back later. It's a pattern. We heard the Defense Production Act. Maybe he'd use it, maybe he wouldn't. Maybe this drug is good, but the FDA hasn't approved it. He's been in fights with governors this week. What does he get out of that when he goes after Governor Gretchen Whitmer of Michigan or Jay Inslee of Washington, 2 states that have also been hit hard?
I'm struck by what Kelly O'Donnell used, and she quoted a senior official as saying, this is all about thinking out loud, boy. And I thought, boy, if that doesn't just sum up all things President Trump through the last 3.5 years at times, when confusion has been created by him in some governmental way, it's usually been because what? He's been musing or thinking out loud, and this quarantine situation is a classic case of that. And I think this is where there's been the biggest disconnect between how most of the governors in America have handled this, which is a very sort of Joe Friday approach, just the facts, sir, just the facts, ma'am type of approach, versus the president who continues to personalize the response, continues to personalize any ask or criticism. I mean, it was oddly revelatory, Willie, on Friday that the president admitted he allows personal political views and personal slights to inform how he deals or handles with certain governors. It was a striking admission. On one hand, you're like, well, it's blunt honesty there, but it's also a way to create even more problems in this response.
Yeah, thinking out loud has heavy implications in a moment like this. Chuck, thank you very much. Just a little tease of what you'll hear this morning on Meet the Press, when Chuck is joined exclusively by presidential candidate and former Vice President Joe Biden.